Hello everyone, welcome to Kinesiology 2030, and today's lecture is going to be evaluating the use of alcohol, caffeine, over-the-counter drugs, supplements, and cannabis. So I do consider this part of nutrition because a lot of the times, a lot of these substances, they do come in food form, or drink form, or they are actually part of our nutritional day. Something like supplement or caffeine, even alcohol, is going to be considered part of our nutritional day. Cannabis and over-the-counter drugs, not really part of a nutritional aspect, but I do feel it fits well in talking about the misuse, the use, the abuse, and the addiction of these types of substances, because whether it's over the counter drugs or cannabis or alcohol or caffeine or sugar, one thing that they all have common is they can lead to addiction. And what we want to do is really go over how to avoid that addiction and utilize these substances in a healthy manner. It's a lot like food. We talked about the relationship of food when it comes to things like alcohol, caffeine, cannabis, supplements. We need to make sure we have a good relationship with them in order to consume them healthily and get the benefits out of them that we're starting to see. So this is from chapter 11 of the textbook. And what we're going to be covering, as I said, is we're going to look at alcohol, caffeine, over-the-counter drugs, supplements, and cannabis. But we're really going to be just looking and understanding use, misuse, abuse, and addiction of these substances. So the first thing I want to talk about is just that, and that's the defining the use, misuse, abuse, and addiction. So we have a bit of an idea of what the differences are, because when it comes to drugs, alcohol, over-the-counter medicine, supplements, even sugar, as I mentioned, understanding these really helps us develop a good relationship with them so we can use them healthily. And I do want to stress that I believe that alcohol, I believe that cannabis, I believe that over-the-counter drugs can be used healthily to help us for certain parts of our life and certain parts of our time. And like I said, the important part is understanding them, having a good relationship, and making sure that we use them responsibly. So when it comes to the definitions of each, I want to go over drug use, drug misuse, drug abuse, and addiction. And I also want you to make sure that when I'm going through these definitions, you understand that these are similar definitions if we were talking about alcohol use or alcohol misuse or alcohol abuse and alcohol addiction. Same thing with something like supplements. Okay, we can be addicted to supplements. We can abuse supplements. So we need to realize what those definitions are. So first, when it comes to the use, so we'll use drug use as our definition title for this. And drug use essentially is taking a substance the way it was intended. And this, I believe, is the definition of having a good relationship with a drug or with alcohol and using it for the purpose of what it can actually do and the health benefits that it can create. So if we look at something like cannabis, we're starting to see that there's still not a lot of research on it, but we're starting to see that there are some benefits to things like cannabinoids, which are also known as CBD. We're starting to see some benefits to THC use in cannabis as well. It's just, what you like and what you need, and in terms of how it's helping you. And the first thing I also want to talk about is I in no way am I suggesting that you go out and take these drugs if you've never taken them before, because they're going to be good and healthy for you. Like I said, it's your ethics, your choices, what you believe. That's a huge part of drug use. And people who, don't believe that drugs are good for the body, then they should avoid them because that's part of their belief system. What I'm trying to tell you is if your belief and your structure believes that, cannabis use or alcohol use is something that is part of your lifestyle and it's something that you want to consume, I just want to make sure that you understand the steps to take to make sure that you're in this drug use aspect and you have a good relationship with it. Because I don't want anyone to, first off, think that, taking cannabis is bad or drinking alcohol is bad. But if it's something that you don't believe in, then that's completely fine. And I'm going to be completely honest with you. I use CBD. I don't use cannabis with THC. I don't personally like the feeling of being quote unquote high, but I like the benefits of what CBD, the cannabinoids, can actually do to the human body. And so when I have excess inflammation in my body for whatever reason, I find that having CBD actually helps with the inflammation. It decreases pain, and it really makes a huge difference in my health. So I believe that CBD is good for me personally. And like I've said before, we're our own scientists. Do your research yourself. Go out, read about something before trying something and making sure that you understand everything, the risks, the side effects, what it can do for you before you actually start taking it, right? It's about being educated. It's educating your decision, because the bottom line is drugs can lead to very, very harmful side effects if we aren't using them appropriately. So that's why I'm trying to create this drug use it appropriately, and sort of give you an idea of where I am and where I feel with it. All right. And it's the same thing with alcohol. All right. I don't drink alcohol very often, but I do enjoy it from time to time. For me, it's a social thing. When I get together with friends, I like having a few drinks. And that's just me being completely honest and transparent with you guys, so you know where my stance is while I continue on with this lecture. Because I do think this is an important lecture for all of us, because I was a college student. I understand what it's like to be your age. I understand all the pressures, what comes with being a college student, and I just want to make sure everyone understands that you're your own scientist. Do your research for yourself and make sure you develop the proper relationship with any type of substance that you partake in, and make sure we don't cross any lines where we're going to have harmful effects. Right? And those things we need to realize are things like getting behind the wheel when we're on a substance and trying to drive. Like, that's something that is, to me, just zero tolerance and shouldn't be happening, right? Understanding about what we're putting in our body and what it can do, and making sure that we do it responsibly. Because, like I've said, there's not a ton of research, especially in the cannabis world, but we're starting to see tiny little glimpses of what can result if we take certain types of cannabis. And I think it's important that everyone knows that and educates themselves on it. So that's why I want you to understand that drug use is taking a substance the way it was intended, right? So if, for example, you have surgery, this is probably one of the biggest reasons I started getting interested in CBD. So you have a surgery, right? You take a shoulder surgery, for example. If you've ever had a shoulder surgery, you know it's painful and it affects a lot of things, especially things like sleep. So what tends to happen is you'll get a prescription from a doctor for over-the-counter prescription drug. It tends to be a harder drug. Doctors are a little bit more a little bit more careful of what they prescribe people now. 5-6 years ago, it would have been probably Oxycontin that you got. I think they're a little hard pressed to prescribe that now because it's leading to so many problems. The opioid crisis that we are seeing in our society today, a lot of it has to do with starting from pain medications like Oxy and it just spiraling out of control. So doctors are a little bit more careful of what they prescribe. But let's just say you get a shoulder surgery. You have a hard time sleeping. It's a lot of pain. Being on it is tough. Drug use would be taking the medication that the doctor prescribed you and the proper doses that the doctor prescribed you to help alleviate the pain that your shoulder's feeling and helping you. We've talked about sedation and sleep. Is it the best thing? No, but if you're in extreme pain, then sometimes that's what needs to happen. But you have to make sure that you take it appropriately. You have to take it the way the doctor prescribed you. And one of the main reasons I have really started exploring CBD for pain relief and inflammation relief is because I had a client that had shoulder surgery, and he was given Oxy as the pain medication for his prescription, and he just didn't like it. He just felt whacked out. He felt in a fog. He didn't feel good on it. So he took it into his own hands, and as I said, be your own scientist, do your own research. And he looked out for other ways to help alleviate the pain. And one of the things he came across was it was just at the time anecdotal research about CBD helping with pain management and helping with sleeping. And so this was before cannabis was legalized in Canada. It was at a time when you had to get a prescription. So he went to the doctor and he said, look, I really want a different pain management plan and I want to try CBD. And so the doctor gladly wrote him up a CBD cannabis prescription. He went to a dispensary and they helped him pick the right type of dose for what he was going through. And he could not believe the difference. He couldn't believe the difference in his sleep quality while on it compared to Oxy. He couldn't believe the inflammation changes that happened when he was taking CBD versus Oxy. His physiotherapist couldn't believe the progress he was going through, right? So that's when I really started exploring and trying to figure out why CBD was doing this for him. And, because it's something that is, natural, grown from the earth, it has properties like things like pineapple do, and it has anti-inflammatory properties. And it's a great anti-inflammatory, and it's something that I don't regularly use, but if I ever have an injury, I will use it to help rehab my injury because it does decrease swelling and it does help with the pain management. So by really exploring that and then using it the way you should and what it's for, that helps develop a good relationship. And it's the same thing with, prescription drugs. If you use it what it's intended for, then you have a healthy relationship with it and it's going to help you. It's not going to hurt you in that case, right? So if the doctor ever has to prescribe you with certain pain medications, just take it the way the doctor has laid out the plan, because it's going to help you. It's going to give you a better relationship with that specific drug. And it's not going to lead to further problems, greater side effects. And that's one thing about the human body is small doses of anything that we give the human body can tolerate and deal with appropriately. It's the larger doses that it struggles with. And you can see that with everything. If we take too many vitamins, our body's going to struggle with it. If we drink too much water, we can die. If we eat too much food, we gain weight and get heart disease, right? So the body can only withstand so much. So again, it just comes down to a consumption issue. And then that's when we start getting into things like drug misuse, drug abuse, addiction, or alcohol misuse, alcohol abuse, and addiction. So if we go to drug misuse, what we're talking about there is really taking a substance for a reason different from the way it was intended. So we see a lot of problems with drug misuse with those prescription type drugs. And it's why we have a massive opioid problem in our society, especially in Vancouver. It's because you always look at it's so unfortunate when you go downtown to East Hastings and you see the people, and their substance abuse problems and addiction that they have. And a lot of it started with just, like I said, over-the-counter prescription drugs that led to drug misuse and then abuse and then to addiction. So if you're prescribed with a medication and you're taking that medication to help you, then that is fine. But if you start taking it because you feel like it or because you like the way you feel on it, then that's the line that we're starting to cross. Right? Another great example I have of drug misuse is someone who I know is they have a son who has ADHD and is on ADHD medication. And if you know anything about ADHD medication, you know it's a stimulant. And it's pretty high. They can be pretty high potent stimulants too. Anyways, the mother of this child decided to take one of the child's stimulants. And, apparently she was super productive, but unproductive at the same time. She was very scrambled, but getting a lot of things done, but not really doing it properly because the dose wasn't set for her. She doesn't have ADHD, so she's not missing the stimulant that someone with ADHD is missing. And so it messes with you. And then that's really just drug misuse. You're taking a drug that wasn't prescribed for your body weight, for your condition, or anything that has anything to do with you, right? It's the same thing I've been stressing all semester. We are different people. We are individuals. Everything is different for us. And that goes with prescription drugs or alcohol or drug or whatever, cannabis. We all are going to react different to it, and we all have different tolerances and levels that we need for these prescription drugs. And if you go and take someone else's prescription, well, it's who knows what's going to happen because it wasn't designed for you. The plan wasn't designed for you. And that's really what's happening with drug misuse. Even when you are prescribed a drug, you start taking too much of it, or you take it when you don't need it because you just like it. And that starts the slippery slope to addiction. Then we look at drug abuse or alcohol abuse, and this is when we take an excessive use of the drug. Right? So this is when we are, just drinking a lot or like binge drinking or doing lots of drugs excessively and for real no reason, right? Other than we just want to. And then drug abuse will eventually lead to addiction. And the problem with addiction is now you need the drug not to feel high, but just to feel normal. And, that's the big problem with alcohol and drug use is when we get to that point of addiction, now it's just we're trying to get the drug so we can just feel normal and get through our day instead of, not having a substance to make us feel normal. So that's the slippery slope that we have to look at, and understanding that really is important. And we can understand it a little bit better by distinguishing between drug misuse, abuse, and addiction. So when we look at drug misuse examples, all right, a couple examples of drug misuse. I'm sure some of us have probably experienced this in some way or form, whether friends have done it or we've done it ourselves. And that is, you're getting ready to go out with your friends. You're getting ready to do something with your friends. Maybe you're going to the club, going to the bar. And before you go out, you line up a bunch of shots and you take a bunch of shots, thinking it's going to amp you up and get you ready to go. But in reality, we need to understand that alcohol, it's a depressant. It's not a stimulant, right? So when we add that extra depressant into our body, it may feel like it's, making us feel good at the time. But I mean, one of the big things about a hangover is it's because we're dehydrated and because we have this depressant, and it's depressed our central nervous system. And we have, we feel dehydrated and we feel depressed and we feel sad. And it's a lot has to do with because of what we did to our central nervous system with this depressant. Alcohol is not a stimulant. So we're misusing alcohol when we try to take a bunch of shots to get us fired up before we go somewhere. Another example is if we use a roommate's leftover prescription. Right, like let's say they had a prescription for some pain management care. They had some pills left over, and you got an injury or a little pain, and you're having a hard time sleeping, and so you decide to take their medication for it. All right, that is drug misuse because it wasn't really prescribed for you. Now, if we look at drug abuse, first thing we need to realize that when it comes to drug abuse, it has major implications both for our personal, social, and potentially professional life. We can get some very negative consequences for our personal, social, professional life when we abuse drugs, because when we abuse drugs, we tend to it tends to lead to some problems. Like if you look at alcohol, for example, which is probably one of the most commonly abused of drugs or substance, if you will. And a lot of the times when we drink too much, it changes our personality. It totally changes our personality, and some people they become belligerent, and they become belligerent at a par or at a bar or at a club, or someone's house, and it causes a massive problem. I mean, it could lead to being arrested. It could lead to getting injured. It could lead to losing friends. It could lead to losing jobs, all because we abused alcohol. We just drank too much of it, and that's always a sign of two things. First off, not having a healthy relationship with the substance, but also potentially going to the side of addiction if we're not careful. So some of the commonly abused drugs in our society are cannabis, marijuana. Now we're starting to see vaporizers being an abused drug because it's got high amounts of nicotine. And when you vape nicotine, alcohol obviously has been one forever. Heroin, cocaine, meth, prescription drugs, hallucinogenics, all are ones that are commonly abused drugs in our society, and ones we need to be aware of, understand the negative impacts that these drugs can cause in us, and realize that They may make us feel good, but we have to realize the consequences that lead down the road because of it. So we need to make sure we have a good relationship with it. When it comes to things like heroin, cocaine, meth, hallucinogenics, I mean, those are the ones we should be avoiding completely, because they're the ones that become potentially very addicting, especially heroin, cocaine, and meth. Now, when it comes to drug addiction is, again, like I said, it's just trying to feel normal. So it's something like taking the maximum dosage of pain medication allowed each day, but not feeling any relief. So if you get to the point where you're taking, a certain amount of drugs, prescription drugs a day, and you don't get any relief from them, something's up, especially if you keep taking them after, because if it's not working, if you're at that level of tolerance, then you've obviously taken too much of it. And as I said, it just leads to being normal, right? Just trying to feel normal. So if we look at this, brain scan here of a healthy brain versus someone who is addicted to cocaine, you can see that the activity signal is so much lower in someone who is addicted to cocaine. Now, this is when they would be off. They wouldn't be having any cocaine in their system, so their brain isn't even functioning normally. And so they need to get the cocaine in them to try and try to get their brain to feel normal again. And one of the best visuals I've ever seen when it comes to someone becoming addicted to drugs is the following thing. So as you know, normal is known as homeostasis. So when we are at homeostasis, we have this steady line. All right. So most of us right now are probably sitting at homeostasis, right? We're not too high. We're not too low. We're just at a homeostatic sense. Now, what happens is when we take a drug, we respond to it. All right. And that initial response is we get high. So we go way above our homeostatic sense. So we start feeling really good. All right. We start feeling really good and we're in the high. Now, what happens is when the drug wears off, we then actually have this really big drop and we go way below homeostasis when the drug wears off. We go way down, right? So when you drink too much, a hangover would be that case. You're below homeostasis. When you take some other type of drug, you feel awful. You feel you're crashed. You just don't feel great, right? The first time you take the drug, the crash probably isn't as bad, all right? But as you take it more and more, the crash becomes a little bit worse. But the key to it is we go below what normal is, what our normal feeling is. Then what starts to happen is we get into the drug abuse side of things. So we really, then after we get from that low, we go back up to homeostasis. But the thing that we don't realize is every time we take a drug, we don't quite get to our original state. All right. So the first few times, you're not even going to notice it. Like it's very, very slight. Right? It's very slight, but you don't quite get to where you were before. So it's almost like it develops a new homeostasis, right? Now, for the most part, if, you take the drug and you don't do that drug or you don't do anything for months and months and months and months, then you start building up back to where you were before, especially if you're someone who's active and you're going through physical adaptations because of activity. But essentially what happens is you don't quite get to that original homeostatic line. Now, the problem becomes is when we get into the abuse side of it, right? So now we really liked that feeling we had when we first took the drug. We really liked it. So now what we want to do is we're going to take it again. We want to get that high, the same high we had before. But the problem is, because we're at a lower homeostatic line than we were before, we can't quite get to the high that we're at. We just can't quite get to the high that we're at. And then we drop low again when we crash. And then we come back to normal. And then we have a new homeostatic line. And then we go again. Take the drug. Try and reach that high. We can't quite get there. Crash down. And then return back to a new homeostatic line. So what happens with drug abuse essentially is you go through this process over and over and over and over again, chasing the high, chasing the high, chasing the high. And it's why, people say things like cannabis are a gateway drug to other drugs, is because when you take cannabis regularly, you can't feel like you quite get to that high like you did before, so you start taking stronger drugs. Well, stronger drugs are going to lead to a greater crash and a greater drop in homeostasis. So essentially what happens in drug abuse is you continue to chase this high, and you get to the point where that homeostatic line is so low that you're just trying to take the drug to get to where you were before, just to feel normal. And that's when we get into the drug addiction, is when we're trying to take that drug just to feel normal. So drug abuse, alcohol abuse, eventually will lead to drug addiction, especially if we don't get an intervention for the person early enough to see that they are having a problem and they need some help. So really, when it comes down to misuse, abuse, addiction, a lot of it is behavioral, right? So we see behaviors that have potential to alter our mood, and then that was what leads to misuse, abuse, and addiction. So when we look at misuse of behavior, we usually have behavior that's avoiding what we are expected to do or beyond our capacity. Then the behavior of abuse is when we have excessive engagement in the behavior, right? So, it's just we're using it constantly to obtain the behavior that we are seeking out from the substance. And then the addiction of behavior is just compulsive engagement in the behavior to help us return to a normal mood state. And we get to that point, and then it's just, that's addiction. And obviously, misuse, abuse, addiction, we want to avoid completely. And we need to understand that this is for all substances. Like this misuse, abuse, addiction, it's for all substances. Like I said, cannabis, harder drugs, over-the-counter drugs, alcohol, even sugar. Because sugar, we get the exact same response. And that's one thing that people don't realize is with sugar and even food, it alters our behavior. It alters our feeling. And a lot of the time, we're eating sugar because we're addicted to it. We're just trying to eat sugar to feel a certain way we did before. And, sugar could be very addicting aspect of nutrition. And it's why we need to make sure we understand how to use sugar properly. Now, when it comes to alcohol, for the most part, I think most of our society probably has a pretty good understanding of alcohol. Probably have a good understanding of what it is, what it does to us, what the point of it is, and how it can affect us. I think we all pretty have a good understanding about it. The thing that people may not realize about alcohol are things like it's a depressant, not a stimulant. It's a diuretic, so it dehydrates us. And it completely turns off our ability to make good decisions, as we're probably all well aware of. And that's why so many people get behind the wheel when drinking, is because they can't make a good decision for themselves. They think they're okay after a certain amount of drinks and they'll be fine, and they just get behind the wheel and it's not safe. So that's why I think it's important to know what alcohol does to your body, what the health aspects of alcohol is, and teach yourself how to make good decisions while drinking. Because if we're responsible, then we can use alcohol safely and use it as a social, fun substance. So when it comes to drinking, there are some low risk drinking guidelines, because we do see there is some research that shows certain types of alcohol do present some health aspects. We see certain types of red wine helps decrease blood pressure. Right, so there are some studies that do indicate that some alcohol is good. It does have some health benefits, right? It can help relax us, and that would decrease our blood pressure. But again, it comes down to alcohol use versus misuse, abuse, and addiction. So we live in a culture where alcohol is acceptable. Alcohol is social. Alcohol is readily available. Alcohol is controlled through government agencies. It's taxed through government agencies. It's a substance that we have regularly available in our society, and that is throughout all societies. So the best thing to do is try to promote a culture of moderation when it comes to alcohol. Understand, just like nutrition, a moderate amount is going to be okay. So generally, we look at this as being the moderate or the limits allowed for people for drinking. So it's about 10 drinks per week for females, 15 drinks per week for males. Right? So we're looking on average, about 1.5, 2 drinks a day almost. And then there's some, really important guidelines when it comes to drinking, and that's things like don't drink if you're pregnant. Don't drink when you're on other drugs. Ask Tiger Woods about that. And if you don't know what I'm talking about, take a look at Tiger Woods when he was taking some pain medications and had some alcohol and had a run-in with the police because of it. And they asked him to do the alphabet, and he could barely even do it because it messes with you. Right? It's like 2 different substances taking at the same time is going to cause major problems. So we need to make sure that if we're on prescription medication, we don't drink alcohol at the same time, because it can they can conflict with one another and really cause you to have some interesting side effects. Don't drink if you're operating machinery. Don't drink and drive. Simple, right? All just simple decisions. But what we need to do in order to make the right decision is make sure we have a plan before we start drinking. I think that's the best thing to do, right? It seems so simple, but yet it's obviously difficult because not everybody's doing it, right? So if you're going to go out drinking, make sure someone's driving. Leave your keys at home. Just Decide when you are of sober mind what the right decision is going to be, and then that will help you follow through with it. Now, when it comes to low risk guidelines, there's a Netflix documentary I watched about alcohol, and it was one of the most fascinating and educational documentaries on alcohol I've ever seen. It's called The Truth About Alcohol. And like I said, it's on Netflix, and this emergency room doctor from England goes and tries to figure out about alcohol, because England put a bunch of new guidelines of healthy drinking for their society, and he wanted to explore what happens when you drink a certain amount and what happens when you drink too much. And it's really interesting because he's an emergency room doctor. He obviously understands about the body, yet he was relatively clueless about alcohol and his drinking habits. And so it was just really interesting to see these various experiments that he did during this documentary. One of them was they looked at alcohol consumption and calories, and how people who were drinking more ate more food than people who were drinking less. So it was very fascinating. And if you're looking for something to watch on Netflix, if you have Netflix, check out The Truth About Alcohol. It's a fantastic little documentary. It's a lot of fun. So when it comes to consuming alcohol, it's really all about doing it responsibly. If we can consume alcohol responsibly, then that tells me that you have a healthy relationship with alcohol, and you're probably drinking in moderation and you're drinking the right amounts. So some really simplistic drinking habits that you can do are eating a good meal prior to consuming alcohol. And that documentary I told you about had a great experiment on how helpful eating is when you drink alcohol, and how it helps. Having snacks is important as well. Again, it's just to keep your stomach full so you can absorb the alcohol. You just want to make sure that you're not eating too many snacks, and then because when you're drinking alcohol, it's obviously extra calories, and then if you're having extra snacks upon that, that's extra calories. So it's again comes down to moderation. If you're doing both with moderation, then you're probably fine. I think the most important thing to do when drinking is drink water. Because like I said, it's a depressant, it's a diuretic, it dehydrates you. All a hangover really is just being really badly dehydrated. So if you are drinking water throughout while you're drinking alcohol, your body's going to stay hydrated. It's going to decrease the side effects. It's not going to give you a big as hangover as it possibly could. So drinking water is important, but also avoiding shots, because taking shots it's easy to line up 4 or 5 shots and throw them back in 10 seconds. Well, you just consumed a ton of alcohol in a short period of time, and that is when we get into the misuse and potential abuse of alcohol. So shots, I know everyone loves a good shot, but it's leads to the path of misuse and abuse. So avoiding shots is sometimes a very, very wise decision when out having a few drinks with friends. Another thing to make sure you do, and this isn't just with alcohol, it's with all substances, whether it's cannabis, supplements that you're taking, caffeine, alcohol, sugar, understanding health risks that come along with it. So having a good relationship with these substances is understanding what the health risks are. So when it comes to alcohol, understanding health risks, understanding things about it is important. And here are 5 health risks that I feel you should be aware of. The first one is alcohol is the second leading substance causing harm to Canadians right now. So alcohol is the second leading substance causing harm to Canadians. If you're wondering what the first one is, it's smoking. Although I believe that one is starting to decline in numbers, but as of now, it's still number 1. But alcohol is number 2. So when it comes to alcohol misuse, alcohol abuse, is related to getting psoriasis of the liver, which is scarring of the liver, inflammation of the liver. And the main reason of that is because alcohol is processed through the liver. It is related to some cancers and some other diseases that are rather serious, like kidney disease as well. 19.5% of Canadians over 12 years old have reported heavy drinking once per month. I thought that was an interesting stat, especially because it was over 12 years old. What age are kids starting to drink now? It's pretty shocking. But 19.5% of Canadians over 12 report drinking heavy once per month. I'm going to say that younger populations, I haven't seen any stats on this, but I would say probably age 16 to 25 are probably the age categories that have the heavy drinking episodes the most. So I imagine most of you guys fall in that, so be aware of that. And there is some studies that show moderate consumption can reduce heart disease, potential strokes, and type 2 diabetes. So there are some studies that show that there's good health response to alcohol. But again, it's moderation and it's having a good relationship with it. Let's talk about caffeine consumption, because I'm sure this is a substance we are all aware of as well. I imagine the majority of us are caffeine consumers, that we have daily caffeine. So recommended adult consumption of caffeine is 400 milligrams per day. So understanding that's important. And then understanding what you're eating that has caffeine in it. What is the serving sizes, and how much caffeines in milligrams are there? So if you look at coffee is probably the most typical caffeine drink that we have in our society. I know majority of you probably drink at least 1 cup a day, maybe 2. So serving size, if we look at most average serving sizes for coffee, looking at about 237 milliliters, which is almost a cup. Can be anywhere from 135 milligrams of caffeine to 179 milligrams of caffeine. So knowing what type of coffee you drink will help you with your serving size and hitting that recommended consumption of 400 milligrams. So look at that. Filtered drip coffee, brewed coffee, 237 milliliters, which is just under a cup, right? How many of you have, a grande cup, which is basically like 2 cups of coffee in one serving, and you're almost getting to your 400 milligrams per day with that one grande. So be aware of that. Some other products to think about with caffeine is there's caffeine in tea, not a ton, right? So leaf bag tea's got the most at about 50 milligrams per cup. Soft drinks, regular and diet, anywhere from 36 to 46 milligrams of caffeine. So that's the moderate level. Anything with chocolate has caffeine. And essentially, the darker the chocolate, the more caffeine it has. So something like chocolate milk would have about 8 milligrams. Hot cocoa powder mix would have about 5. A chocolate bar would be about 7 milligrams. And then as the dark chocolate or the bitterness percentage goes up, the caffeine intake goes up. So a baking chocolate, which is a dark chocolate unsweetened, is about 25 to 58 milligrams of dark chocolate. And you can see other chocolate aspects, puddings, cakes, mousse. They all have very small amounts of caffeine in them. All right, so think about that as well, because if you're eating chocolate at night, that could affect your sleep, and that's something. A lot of times we have desserts after dinner. Have a nice big piece of chocolate cake. Well, you're getting some caffeine in that, so be aware of that as well. And energy drinks, well, they're a whole other beast. It just depends on the brand, the type. But there's some energy drinks that are so packed with caffeine that are into the 200, 250 milligrams. You need to be really aware of that. I am not a proponent of energy drinks. I think, they are some of the worst products available because they just jack the sugar. They just jack the caffeine. I see these people walking around, and I apologize if you're a person who enjoys this type of beverage, but I see people walking around with those cans that are twice the size of a can of regular pop, and it's like nitro fuel, and it's like 250 to 300 milligrams of caffeine with about 200 grams of sugar. And I personally just do not recommend those drinks. So when it comes to caffeine, just like alcohol, just like other substances, consuming them responsibly is important. And making sure that it's not going to affect your sleep is also something that's important, because we want to make sure we're getting adequate amount of sleep every night. And by making sure we have caffeine, a caffeine curfew. All right, I always suggest for people to have a caffeine curfew, and I try to make their caffeine curfew at about 11 a.m. So the last drip of caffeine that goes into your body should be around 11 a.m. That way it will clear your system by the time you're ready to go to sleep. So when it comes to drinking caffeine responsibly, that's one responsible aspect I think you should consider, and that's having a caffeine curfew. Make sure you understand the calorie consumption when it comes to drinks. Like I talked about those energy drinks, those are just empty calories with a ton of caffeine. There's no real benefit to them other than increasing your heart rate and your blood pressure regularly, which isn't good for anyone. We need to realize that roasting coffee, it doesn't change the amount of caffeine. It just basically changes the flavor. I know a lot of people think that when you roast it, it cuts the caffeine, but that's not the case. It just changes the flavor. And then I've already given you my caution when it comes to energy drinks. They are bad news in my eyes. So health risks and benefits of caffeine. So a couple things you need to realize. There are some research studies that show moderate consumption of caffeine could reduce risk of cardiovascular disease, type 2 diabetes, Parkinson's disease, uterine and liver cancer, psoriasis, and gout. All right, so there are some research studies showing benefits to caffeine. That's why I don't say to people, don't drink caffeine at all. I personally have cut caffeine out of my life. I just try to avoid it now, and that mainly is due to around my sleep. But there are some benefits to it, that's for sure. We're starting to see that small amounts of dark chocolate The caffeine there can actually offer an ADHD person the stimulant they need to be able to be successful throughout a time when they need concentration. One thing we need to realize that caffeine is a stimulant, but also a diuretic. So it's kind of similar to alcohol, but different, in the terms of it's a diuretic as well, but obviously caffeine's a stimulant, alcohol is not. So we have to realize that caffeine will dehydrate you. So you need to be aware of that when drinking caffeine. Caffeine is kind of interesting too, because if you take my human performance class 3303, we'll talk about caffeine as a performance enhancer. Caffeine is actually banned. Certain levels of caffeine is banned by the World Anti-Doping Agency because it can enhance performance when taken at high levels. Marathon runners use it to help release free fatty acids into their system so they can spare glycogen during long races. It can help obviously stimulate you for certain types of events that require high stimulation, high power type events. So it is something that is banned by WADA. Now, one thing I want to talk about here is when it comes to drugs, how to take them safely. Now, what I'm really talking about here is drugs that are obviously prescribed to you, and understanding a couple aspects of drugs and taking them safely. So when it comes to over-the-counter drugs, we have to realize that over-the-counter drugs are safe if used properly. And what I'm talking about here are things like mild pain relievers, cold and flu, ones that you can literally just go into the pharmacy and just purchase without a prescription, right? They are effective when used properly. I try to avoid... I don't take a lot of over-counter pain medication. When I do, like I said, when I do have a pain, I try to first manage it through stretching, exercise, TENS therapy, massage therapy, myofascial release therapy. I try that first. If it's starting to affect my sleep, I then will create a pain management plan, and my pain management plan usually involves CBD. Very rarely do I take over-counter medication because, again, I try to use as many natural aspects of life as possible, and I believe that over-the-counter medication is chemically enhanced, and I try to avoid that. And that's just personal opinion, personal philosophy, and so I don't take a lot of over-the-counter drugs. If I ever do, it's bare minimum amounts, because you never know when you get to a point in life when you'll need them. And if you take them a ton in your younger life, then they won't be as effective as you get older. But my plan is to take as little of those as possible throughout my entire life. When it comes to prescription drugs, it's absolutely important to make sure you follow directions. Not following directions of hard prescription pain medications is one of the reasons we are in this opioid crisis, and why we're starting to see so many people addicted to some pretty hard drugs, because they started off with prescription drugs and moved into drugs like heroin. And when you get into those drugs, you just don't know what you're getting all the time, right? A lot of them are starting to be laced with fentanyl, and that's starting to cause overdoses, and it's quite sad. Oral ingestion of drugs is the most common form. There are injection methods. They're second most common. And the injection methods that we have are intravenous, which essentially means administering directly into the venous circulation via syringe. Intramuscular is when we inject right into the muscle, and subcutaneous is when we inject just between the skin and the muscle in the tissue layer right there. Most of us probably aren't injecting ourselves with too many drugs unless we're diabetics. Then we would use an injection method. There's a couple other ones as well. There's some new cholesterol medication that you can inject yourself, but it'll be one of the two ways. Generally, intramuscular is the easiest for someone to administer themselves. Intravenous drugs, obviously things like heroin, drugs like that are injected intravenously. Also, when we look at if taking steroids, they tend to be injected as well, and they're injected into the muscle. But obviously, those are the ones we really want to avoid. If you take my 3303 class, I will talk about performance-enhancing drugs, and a little teaser for those who are interested in taking that class. I will talk about how you can safely and effectively use performance-enhancing drugs. Not saying that I believe in them. I'm just saying that we can effectively and safely use performance-enhancing drugs. But that's a whole other topic, and that's why I leave it for 3303. Another way to take drugs is inhalation. It tends to be the quickest method. We also have suppositories, which absorb drugs very quickly. We have inoculation, which is more slow dispersal of drugs, and that goes through, inunction, pronounced that wrong. That goes through more of a slow dispersal of the drugs through your skin. So you may have a patch that you put on your skin, and then it just slowly disperses the drug. There's some pain medication that could be done that way as well. Like everything else, you need to make sure that you understand the health risks of consuming over-the-counter drugs. Benefits of over-the-counter drugs, obviously easy access. If you ever need them, they're there. There's a wide variety to choose from. There's extra strength, there's regular strength. They're affordable, relatively low cost, and they are fast acting. So sometimes when you have minor pains, headaches, something like that, these types of medications will help quickly. Risks of over-the-counter drugs, they will include misuse and abuse, which would lead to impact of long-term use and tolerance, and could lead to addiction. Generally, it would lead to taking harder drugs, so going into more of the drug abuse of stronger drugs. But anti-inflammatories like Advil, taking too many of them could lead to kidney problems as well, and that's something to note, because a lot of athletes take a lot of pain medication, a lot of anti-inflammatories, and it is strenuous on their kidneys. Okay, let's talk about consuming cannabis responsibly. Traditionally, I never had this in a lecture of mine because it wasn't a legal drug, and so I didn't want to talk about consuming a legal drug responsibly. So I've added it now because obviously cannabis is a legal substance in our society, and it is something that is available to anyone who is 19 years and older. And so we need to understand how to consume it responsibly in order to use it effectively. So there is limited research on cannabis. There definitely is more interest in getting research out there now that we're starting to see it being legalized. So people want a better understanding of what it can do. There is some evidence that supports using it to relieve chronic pain, as I mentioned. There's some strong evidence that shows it can manage muscle spasms associated with MS. A long time now, we realize that it helps with nausea and vomiting during chemotherapy. So it's been prescribed for cancer patients for years now. Also, it's been a treatment plan for patients with glaucoma, which is an eye condition, and the pain from glaucoma could be quite unbearable, and cannabis helps with that. And also, it can help stimulate appetite with individuals with HIV. So there are some benefits to it, and using it responsibly is the most important thing, right? Making sure that you're in the drug use category, not misuse, or abuse, or addiction. So again, understanding health benefits of cannabis use is important. One thing we do need to realize about smoking, inhaling and smoking cannabis, is there's more tar and carbon monoxide taken in from smoking marijuana than from a filtered cigarette. So a lot of people smoke marijuana. They're like, they justify it. They say, oh, it's not like smoking a cigarette. But it does have more tar, carbon monoxide than smoking cigarette does. The only difference is most people smoke like a pack a day versus someone who smokes marijuana, which isn't going to be the equivalent of a pack a day. But, you're still smoking in tar and carbon monoxide, and it's still going to hurt your lungs. For some people, it can lead to confusion, anxiety, fear, and panic. Some people do not do well on it. And that's like any substance, alcohol, a supplement, over-the-counter drugs. It's not going to be for everybody. And understanding that if you're a very anxious person, if you have fears, if you panic easily, chances are when you smoke cannabis or you do cannabis, that's going to be intensified. For some people, it does the opposite. It helps people with anxiety be less anxious. So again, you're your own scientist, do your research. Long-term use could be impairing of memory, and that is very it can really happen if we start using it early in our lives, especially when our brain is still developing. It could impair brain development, which can impair memory. It does affect our ability to concentrate. It will affect capacity for decision making, much like alcohol, so we can make bad decisions while on it. It can affect overall intelligence. Again, this is abuse, I would say, with this. When it comes to memory and intelligence, that's when we're getting into more of the drug abuse aspect. All right, let's talk about supplement use. I don't have a ton to say about supplements because I just want to give you just a quick introduction on it because, like I said, if you go into 3303, we really get into supplements because I think it's an important topic in high performance. But I just want to introduce you to it and talk about a little bit about what it is. First and foremost, the thing you should realize about supplements, it is a major market. In 2020, the value of supplements in the USA was $132 billion. The forecast for 2027 is $230.7 billion. So it's a massive industry. It's making billions of dollars. So obviously, people are taking supplements, using supplements, and in some cases abusing supplements. So we need to know, again, like everything else, health risks, what are associated with it. So for the most part, supplements have great health benefits, right? So the most typical supplements taken are vitamins, minerals, proteins, amino acids, fibers, specialty carbohydrates, omega fatty acids. So we know all of those are micro and macronutrients that help our body. Vitamins and minerals keep our immune function healthy. Proteins and amino acids build our muscles. Carbohydrates and fiber help with digestion and energy. Omega fats help our brain. Our brain helps stimulate our brain. It helps produce and maintain brain cells. It helps heart health. So the supplements that are out there they have health benefits. But again, it's about consumption. Are you taking too many? Are you taking, them for the wrong reasons? Why are you taking them? So we need to understand why we're using our supplements. All right. The two supplements I get the most questions about are creatine and protein. And that's because in kinesiology, resistance training is obviously a very important aspect of kinesiology. So the two supplements people are most interested are in creatine, protein. I am in the camp that both of these are effective, safe supplements that you can use if used properly and used responsibly. Just like anything else, if I take too much creatine, I'm going to have problems. If I take too much protein, I'm going to have problems. All right, there's going to be health problems associated with this. So you need to make sure you're taking the right amounts. All right, we talked about protein calculations. We talked about how to understand how much protein you need. If you're not getting the protein that you need, then by all means, supplement it with protein. Because it's the easiest way to get extra protein. It's the easiest way to get the protein you need is just taking a supplement. If you are going to take a protein supplement, my suggestion is to take the vegan protein supplements. Vegan protein supplements are superior to other protein supplements in my eyes, especially if they have all essential amino acids that are necessary. All right. When purchasing a vegan protein, make sure that the only ingredient isn't pea protein. So a lot of the times, a company like Vega, their protein, 100% pea protein. All right? That is the cheapest type of protein you can use. So, and it's not the best. It's not the most effective. So I use a supplement called Iron Vegan. It has multiple it has pea protein, but has multiple other aspects, other ingredients, in order to meet the essential amino acids that are needed. So make sure you're taking a protein that has all the essential amino acids and has good quality ingredients. With creatine, again, find a reputable brand and make sure that you're taking the right doses. Creatine can be such an effective supplement. It can really help increase your strength levels. It can really increase your power levels. It's great for athletes. It's great for people who are looking to get stronger. But again, if you abuse it, if you take too much, you can potentially damage your kidneys, right? So when it comes to supplement abuse, know that supplements can cause problems as well. Right? So creatine, it can cause blood markers for kidney disease. If you take it regularly and you take too much of it and you go in for blood work, it's going to show that you have kidney problems. Now, there's not a lot of research showing that creatine can cause kidney problems, but it can cause digestional stress and potential kidney ailments. So being aware of that with a supplement like creatine is important, and knowing how much to take is important as well. Now, the thing with supplements is we can start getting to the point of abusing a supplement, and it will lead to performance-enhancing drug use. So that's what happens a lot with supplement, right? Especially like if you're supplementing creatine and pre-workouts, your body eventually tolerates pre-workouts. You don't quite get the pump that you're looking for. Creatine, you've kind of plateaued on creatine. You're looking for the next step. And the next step is usually performance-enhancing drugs. That's why I always suggest for people to first off avoid pre-workouts, because it's basically just like drinking one of those big energy drink cans. You may as well just go buy one of those. But cycling creatine through your program is a very smart thing to do if you want to use creatine. So taking it at certain points of your program to help with certain muscular developments is how you're going to effectively use it and not abuse it. And then if you look at supplement use, misuse, abuse, addiction, all similar to the definitions that we went over for drugs. And that's with all substances, right? Understanding those 4 definitions is going to help you develop the healthy relationship you need with supplements, with substance, with alcohol, with cannabis. And that's what I can't stress enough, is just make sure you're not misusing, abusing. You're using these substances for the benefit for your health. And I truly believe that these substances can have health benefits if used moderately and used appropriately. It's when we get to the misuse and the abuse, it becomes unhealthy. And again, it's exactly like food. If you have a poor relationship with food and you're abusing food and you're misusing food, you're going to be unhealthy. And it's the same thing with substances. If you use them appropriately, it's not going to harm your health. In some cases, it can benefit your health. It can benefit your abilities. It can help you recover from certain times of injury or stress in your life. But if you abuse it, if you misuse it, that's the problem, and that's what we need to avoid. And as health advocates, that's what we have to stress. All right, thanks everyone. I hope you enjoyed this lecture. If you have any comments, questions, please let me know. I always love hearing from everybody. So you have the discussion board. Throw up some thoughts, throw up anything. Like I said, I really enjoy hearing from everybody. I feel like it enhances this whole experience. Thanks, everyone. Have a great day.